Hi, I'm Dr. Geoff Mullan. I'm Chief Medical Officer of Human People, and I've been treating SIBO in my clinic for over 7 years. And I'd like to share some insights we've found during that time and little tips and tricks that you can use to get through the process. So, if you're listening to this at this stage, you probably already tested for SIBO, and there's a number of ways of doing that. The most common way is doing a breath test. And so from that breath test, before you start going down the treatment route, you want to know one of two main things. Has your test come back as a hydrogen positive SIBO, or has it come back as a methane positive SIBO? I'm going to leave the third main type out of the way for the moment, because that will really depend on the type of treatment you use. So that's number one. Number two, is there a very high amount of gas being produced? So we sometimes have these kind of almost like mega cases where the amount of hydrogen produced is enormous. That means there's a really high amount of bacteria that are causing problems. Is there a very high amount of methane? And is there constipation or is there diarrhea? So number one, if there's constipation, this is often linked to methane dominant SIBO. It's quite important to get the gut working properly again before you start treating, because you're basically building up and producing more toxins. And if your body's not getting rid of it, it can cause even more irritation in the gut. An easy way of doing this is using things like magnesium citrate or even just stool softeners. So really important to get things going again. When that has happened, you're then ready to start your treatment of SIBO. So just to recap on SIBO, what's actually happened? So if we separate the intestine into small intestine and large intestine, small intestine is where the body does its absorption. It's where the food passes to from the stomach. And you have all this high energy food. We produce enzymes from our pancreas that breaks all this down. And the small intestine lining is highly absorbable. So it's got these little fingers, these little villi that absorb all the nutrients into the gut or into the bloodstream from the gut. And that's where we get most of our nutrients from. So by the time the remnants of food enters the large intestine, we've actually broken down or removed most of the nutrient value from that food. So kind of think of it as the remnants that's going into the composter. And that's where the bacteria from the large intestine are going to go to work. And in a normal case, then this kind of more inert food stuff ends up in the large intestine. The microbiome, as we talk about, lives in the large intestine. It breaks down things that our body can't and produces more energy, things like butyrate, short chain fatty acids that the body can then use. And that's really important for the lining of the gut in particular, and actually produces a lot of that energy for the body. So that's the normal case. In SIBO, small intestinal bacterial overgrowth, what's happened is some of that bacteria that should be in the large intestine has made its way up into the small intestine. And so the scenario is a little bit different now. All of a sudden, this bacteria, which is now meeting this high energy food before we've broken it down, and when it breaks it down from it, it produces enormous amounts of gas, mostly hydrogen or methane. That's the only way that we produce it. We don't produce hydrogen and methane ourselves. That's done by bacteria. So when that's happening, you get bloating after food. And so that's that very distinctive kind of fullness that you get. And you shouldn't be producing any gas for a full 90 minutes after we eat. Therefore, what we need to do is try to get rid of that bacteria that's in the small intestine. So it's not sterile, but not far off it. It's got a very low amount of bacteria in that area, so the body can work again. The way that we do that is we use something to kill off the bacteria. And that can be either herbal antibiotics or pharmaceutical antibiotics. And, myself and colleagues have discussed the pros and cons of both these over a long time. I think that the pharmaceutical antibiotics probably end up working better, not because they're any more effective, but because it's a shorter course. It's only 2 weeks, whereas the herbal antibiotics need to be taken for 4 weeks. And I often find that compliance for 4 weeks, I've been able to take those 2-3 times a day over 4 weeks, can be a little bit tedious. whereas more people do end up taking them for 2 weeks. So if you go down the pharmaceutical route, if it's just hydrogen dominant, we tend to use rifaximin, and that's a high dose of rifaximin 3 times a day. If it's also got methane in there, we'd add in metronidazole, and that's the one antibiotic you really can't drink any alcohol with because it will make you feel unwell. If we're going down the herbal antibiotic route, again, depending on the combination, but we tend to use a lot of berberine, oregano oil, allicin if there's methane in there, and occasionally we'll add in things like neem. But using too many at once definitely causes an irritation. And that does need to be taken for 4 weeks. The longevity of those herbal antibiotics is quite short, so they do need to be taken 3 times a day. So let's say you've gone through your treatment phase and you've got rid of the bacteria. Is that end of story? Well, it's not really actually, because all you've done is removed it, the bacteria. The gut lining is still probably inflamed. There's little villi, quite likely to be damaged. And so we know that you get still a bit of leakage of remnants of gut bacteria into the blood. We actually have a blood test for measuring that, something called LPS, lipopolysaccharide, which is part of the lining of gram-negative bacteria, and you can actually test for antibodies for that in the gut. And we often find post-SIBO, that's quite high. So post-treatment, there is then a time when you need to try to heal the gut and get it to work better. A couple of things that I often like to use is beeting to improve the acid in the stomach. It's one of the reasons we often get SIBO. Also digestive enzymes that help support the gut. Glutamine helps to soothe it, N-acetylcysteine, silymarin, and probiotics. So all of these things help in that 8 weeks post. The other thing that's really important is what we call a gut motility agent. So one of the reasons we get SIBO is that the small intestine is not contracting properly. So hence the food is remaining in the gut, and that allows the bacteria to grow. So to increase that contraction, procalcipride is one route, or using things like garlic, or boric acid is a good one that you can use, which is a more natural product. And I recommend this for all patients for 2 to 3 months afterwards, at least, to stop a SIBO recurring, because it absolutely can come back. And it's really important to try to reduce that as much as possible in those first few months. Low FODMAP is the other part of the treatment plan. If you're eating high fiber foods, that's what we normally love, but it feeds these bacteria in the small intestine. So only temporarily, this is absolutely not something to be continued. In your dashboard, you will have a list of low FODMAP foods to eat during this time, which foods to avoid as well. That will really help reduce symptoms. I tend to tell people not to be you don't need to be super strict on this, because there is some evidence that if bacteria aren't being fed, then they do die off, but you certainly don't want to be lighting the flame and really increasing their numbers. So if you have the odd little time where you have some FODMAPs, that's absolutely fine. So got the diagnosis, decided what treatment to do. Really important to go down the post-treatment protocol afterwards, and that is the gut healing protocol, and also protocol to keep the gut moving properly as well. Sometimes there's also a little bit of homework to be done to try to work out why did you get it in the first place. I'm not going to go into this in this video at the moment, but post-food poisoning is the most common one. Surgery is another very common one as well. Low stomach acid, if you taking antacids. Something called ileocecal valve incompetence, and that's just something that happens in the gut, and you get a bit of a backwash. So people do ask, do I need to stay on prokinetics long term? Sadly, for some people, to stop SIBO recurring, that is the case, but not with everybody. If you are still getting some bloating a few months afterwards, I strongly recommend repeating your SIBO breath test. Hope all of that's helpful. And if you do have any questions, please feel free to contact us.